backup now.
We were just talking about that too.
Oh, how
I
funny.
talked about it the day I saw your stuff, and I was like, oh, this looks pretty cool.
Yeah. Yeah, that's hilarious. I'm like,
We
was
just
that
need
called
the
sliding up on your DMs or something?
slid up on our DM. Exactly what you did.
It was the algorithm. It matched us.
Yeah.
Yeah.
Well, and I, so who did you work with Kim and Woods?
Oh, I like Kim and
Yeah, Kim and I go way back.
Kim and
Thanks for watching, guys. Right now we're doing a BBL surgery, a Brazilian buttock lip surgery. If you guys have any questions, feel free to
12
ask.
years ago.
Yeah, this Kim is so sad.
Oh, yeah. But Kim and I are friends.
Yeah.
He actually taught me a lot about the injectable business.
Yeah.
He got me thinking about a club for Botox and fillers back in 2010.
Oh, that's great.
So I have a Botox club. You pay $19.99. You get Botox for 1 year.
Oh, that's
You
awesome.
come every month, every other, whatever you need.
Wow.
So he taught me a lot about subscription models.
Interesting.
I love Kim. Who
Yeah,
took
I
his
love
place?
You know, he retired. Oh,
Yeah.
I don't know. They actually, I had just resigned, and then his boss called me and was like, "Do you want to come back on the aesthetic side?" And I was already committed to this deal, so I didn't do it.
Oh, that's nice of you to stay committed. This day and age, not a lot of people are doing
Yeah.
that.
Well.
2 minute stock, lower ab.
Got it?
So we have exciting news. Lauren is here.
Hi.
And Lauren's with the new cellulite product called Avelli, which we'll start using here less than a month. And it's brand new. We'll have it here in the office. It's going to replace Selfina. We'll make a little video of it. Maybe we'll get some of these pre-sold. And
I'm sure we will, but we have a lot of people asking about Selfina.
yeah, we have a lot. Go ahead. All right, so you're with Allergan. Started with the startup. Nice.
Yes. So I'm 4 months into the startup.
Oh my God.
Yeah.
So what did you do for 4 months?
What have I been doing? Running my ass off.
So did they send you by plane or you're driving?
It's my choice. I've been driving a lot.
No.
I know, right?
All over the place.
All over.
That's crazy.
Listening to a lot of books.
Yeah, so then you're almost home, right? After this, you go back to Austin, or you've been in Austin for a while, then came here?
I was in Austin this morning, and I'm working here all day today and tonight.
Oh, okay. I'm sure you'll get people who bite, but nobody has the presence I do here.
Exactly.
Yeah.
I'm excited.
I can shout out on the Billy Madison show. I'm on Wednesdays, Thursdays. That hits 7 states and 500,000 people here. So I'm on every Wednesday. Live radio in the morning.
How fun.
That's why your boys got to do something for me.
I'll
I'll get that stuff out. I'll be like, hey,
let you
ladies.
two hash that out.
I'll definitely talk to him.
That's above my pay grade.
Yeah, usually I talk to the VPs and CEOs. Actually, I'm taking out the CEOs and COO of Renuvion
Oh, nice.
to the Cowboys game
Sweet.
this next weekend.
Very nice.
I'll be going to Inc. 500 because I landed on the Inc. 5000. So I'm going to the gala and meeting. It's number 3784. And number 200 in Texas.
Wow.
In business growth.
That's awesome.
So, welcome everybody. Please share this TikTok. If you need to, we're on our YouTube. And is that Dr. Boo Boo? Is that Latin Heat?
Both.
Okay. I'm Dr. Boo Boo Bell. We named our guy, our second guy, Latin Heat.
I saw the Dr. Boo Boo comment. I love it.
This person said, let's get it on.
Let's get some. Doc, did you get 2 minutes blank?
Gigi says Dr. J is by far the best.
All right.
Gigi Silk.
We love Gigi Silk. Thank you, Gigi.
What was upper ass, Doc?
That was 2 minutes.
I'm not too fond of silk milk.
Gross. Don't know why you're bringing that up, Joe John.
Because of silk. You know what I'm saying?
I know what you're saying. We'll create a nice little journey video. We'll put you up on some billboards. Well, not the. If he wants the individual billboards, those are a little bit more. But the digital ones will be easy.
Rodolfo
I can
said
swap
you're
that out
too
every
old for
week.
surgery. What do you do, Rodolfo? You know I'm just playing with you. You know I'm just playing.
Make sure you're sharing this. Everybody on Latin Heat, he will be back. I'm guest appearing for him. He's going to be answering questions on pain, marketing, and finance. Coming up here pretty soon.
Yes.
We love Dr. Latin Heat. Thank you guys for joining us. Bienvenido. Soy un cirujano plástico. Mi nombre es Dr. Boom Boom Pow. Found out a long time ago to name yourself
That's so smart.
because I was walking in my neighborhood and the guys who walk, you know, I'm kind of all walk at the same time. One guy works for USANA, he's real like high up in the vitamins. He's always like, let me come to your top of your staff, I'll do some meetings with them. I'm like, nah, I'm good. And so anyway, I see him walking, he goes, Dr. J, I gotta tell you a story. So he stopped me, I was walking my bull mastiff. Kind of don't want to approach me very quickly.
That little puppy. I know.
There ain't nothing little about
I know.
that dog. So she was barking, you know, tased her or whatever I did with her, get her to stop. And so he walked up, he goes, my daughter knows Dr. Boom Boom Pow now. And 3 of my friends who are lawyers in town with big billboards, they're my friends. They're like, my kid asked about Dr. Boom, that said that they knew Dr. Boom Boom Pow. I'm like, that's what you get.
That's right. I love it.
Yeah, these are all my friends, so we have a good time with it.
My dad keeps telling me I need to get vanity plates on my car that say "Ass Ma'am" instead of like the Seinfeld "Ass Ma'am."
Oh my God. Until you leave the company, right?
Exactly.
And you're like, God dang it.
I know.
So who's going to take Kim in, man? Oh my God, you would have been a good choice.
Yeah. Well, you know.
They should have called you earlier.
That's yeah. I actually I knew it was coming open.
It's just a tough job.
I was ready to roll.
Yeah.
I was ready to do something.
You know, Tracy Cameron, or Tracy Bellucci now. She was with J&J, but on the Regranic side, the wound healing.
I
And,
feel like I know that name.
yeah, she's my Galderma rep.
I actually think I met. Let me look at my phone. I think I may have met her the other day.
Yeah,
In open house.
Hola, ¿cómo están? From Jessica.
¿Cómo estás usted? Soy Dr. Jeneby. How do you say partner in Spanish? How do you say partner? Mi compañero, nombre es Dr. Latin Heat.
Or you can say my compa, right?
My pompies?
Compa.
Oh. Doc, 150 upper ab.
Ready?
Mi compañeros. Okay.
Consult on Thursday. We can't wait to see you.
Yeah, is that with Dr. Latin Heat or Jeneby?
Is that with Dr. J or Latin Lee? Let us know. That's on your Instagram.
Oh, that's with Dr. Jeneby.
Yeah.
Okay.
Yay.
So how many people are in the higher ups? There's the CEO, CFO, COO? How's that working in your
Yeah,
company?
so we have
I will be
CEO, obviously the CFO. I don't know about a COO, honestly. Our CEO is,
Cool.
she's a president of the board for Sientra, Carol Van Ho.
So she's a part-time CEO. The fraction?
No, I don't know. She's full-time. This is her first startup. She was really integral in a bunch of launches at Keller Gan.
Where's this stuff from? Is it from Europe?
No,
They bought the
actually,
rights?
it was Stanford University Biodesign, Josh Mathauer.
Oh.
Has had several startups, but not in aesthetic. He did Eurolift.
300 doc lower ab, and I'd say 200 lower ab, 100 bonds. Eurolift? What's that?
Eurolift, it was some sort of device for BPA H, I believe.
Oh,
I've
Euro,
never placed
like
the term.
URO.
Yes. Transvascular, which was a stent, Clarent, which was balloon sinuplasty. He also, fun fact, did the Willow breast pump, wireless, cordless, some way past that age, but apparently it's a hit. And then you know what the Corovan is? The needle that goes into the line that allows you to just pour a glass, which has no use in my home because I want more than a glass. But anyway, so that's
The little cork that goes in there that stops it.
it's like a needle. I've never seen it, but it's a needle that you put in your wine, and you can just pour a glass, and then it preserves it. I haven't seen it because I'm not a wine drinker, and B, I would drink a whole bottle of wine.
So they bought it from Stanford, leasing it. They're leasing it, bought it.
That was all came out of Josh McElroy's
Wow.
think tank. So this is his
Thanks for
product.
watching, Cappuccino.
That's cool.
Yeah, a lot of research on it.
Cappy.
Wonder how much research you really need.
Cappuccino.
Cut the band. Interesting.
I think the biggest amount of research came from the cadaver studies and just looking at how the septa grows. And so because it grows real indiscriminately, because you can actually catch the band, feel them cutting, very precise results. I mean, you can eliminate the entire dimple and know when they're off.
I had a lady yesterday come in for retractions. She had gluteal dimpling from a BBL like 20 years ago.
Interesting.
So I booked her for a Selfina, but I didn't know
Yeah.
that was before.
Yeah.
I was like, well, I don't know if I'm gonna I'm gonna get this and when the training's gonna be. So talking to her at 11 today.
Okay.
But I only have 20 left, so you're definitely on the.
Baby.
You're definitely no other thing like it. You and Selfino. I was wondering what was going to happen because I sell a lot of Selfino.
Yeah, we actually, some of the Merz marketing people are on our team now.
When in doubt, steal them out.
That's right.
And thanks for lunch.
Oh, my pleasure.
Obviously, I don't really need any money to pay for my lunch. I'd rather have the girls.
Yeah.
Brings camaraderie.
You guys don't have to bring food.
But I bring food every day anyway for the girl. Breakfast and lunch.
That's awesome. Nice
All
perk.
of the buildings. It is a nice perk. I calculated it as a $30 per day perk. Pre-tax.
Yeah. Yeah.
So like $40 to $45 a day
Yeah.
from your check to eat like this.
Yeah.
So the chef cooks it. Those are the two that you saw come in.
Oh, really?
Yeah.
Damn, that's fancy.
That's right.
Dude, that's how you roll.
Well, the studies have shown that you provide lunch and breakfast, you have 20% more productivity.
Really? Who knew there was clinical data behind it?
There's clinical data.
That's pretty crazy.
Valero had it. They did the data on it. Valero, Exxon, Facebook, and Google.
Wow.
They have campuses where the food's free.
Interesting.
But if you think the number one number 1 hour of least productivity, what do you think it is? I know that.
Thanks for watching, Denise.
Number
My
one?
house is happy hour. But
No,
lunch maybe?
no. Once I tell you, it won't surprise you.
Alright, what is it?
The hour before lunch. Because you're thinking about lunch. You're thinking about, do I have to get my ATM card? Or do I go pull out cash? Then I have to go to that place. Then I have to eat. Then I have to quickly run back.
Yeah.
Here they just go to the kitchen and come back.
That's nice.
So they know it's coming,
Yeah.
so they don't have to worry about thinking about it.
Yeah, that's awesome. You just have a rotating menu?
Yep. Chef does it.
Okay, nice.
He listens to us. If we don't like something, he doesn't put it up again.
Yeah.
All right, Doc, that was 400, right flank?
Ready?
Doc, you can do airplane for her. I know it's not Friday.
Why not?
Will we airplane her on Friday?
There you go. You get to have the airplane.
Okay, guys, what we're doing now is we're doing liposuction. We did the vaser. We're talking to Laura from Avelli, our new cellulite repair. We'll probably pair it with another device like a Morpheus, the little superficial dimpling.
We are performing liposuction right now. This is part of a BBL. Thanks for watching. If you have any questions, feel free to ask. And also, you can hit us up in the DM if you'd like to schedule a consult. Dr. Jeneby is doing a Saturday consult this weekend. Is Dr.
100, Doc. That was right up her back.
We're located in San Antonio, Texas. We have 2 locations, one medical center and one in the Stone Oak area, guys. That will be open like very soon. Doc, is Dr. Cornell doing Saturday consults too or no?
You can ask him.
Okay.
So you use a lot of this, and I would use this also before I use your belly.
Yes.
I probably just soften it up, take
Yeah.
care of some of the other stuff with a vaser. Then I'll use the Avelli and then re-prep for the BBL.
Yeah. Like it.
So what I do with Selfina currently is we flip. They do a basic prep just for sterility. Then they re-prep everything.
Yeah. Yeah, I've seen it done 2 ways. It kind of depends on.
Now, if your thing is a sterile pack, we may not have to prep 2 ways.
Yes, it is.
So it just comes on there and it's hand operated. That may save us at least 20 minutes.
Yeah. In the OR, it's quick.
Okay, yeah.
It's about 30 minutes once you get used. The hardest thing is just getting used to the device.
30 minutes? For how many areas?
On average for 20 impressions. It just depends how fast you are. Does that sound like a lot to you?
Dude, I did a breast dump in 16 minutes just now.
Well, you probably will be the fastest.
Yeah, I don't.
On average in our clinical studies, it was
Okay.
20 minutes in the OR.
Doc,
so
tell her how
average-
long we take us to do tummy tuck here.
Do a quarter of all your time. That's what
Yeah.
Dr. Genevieve said.
So it
59
might
minutes.
take you 10 minutes.
Yes. The Selfina takes like 3 minutes.
Yeah, but you
fine.
have the setup time before, so
Yeah, the setup, that's the issue would be, I'd say about 10 minutes for setup,
Yeah.
6 minutes for the butt, another 10 to 15 minutes for another 30.
yeah,
With yours on the field, that'll change something here
yeah, for
significantly.
sure. And I've seen two different trains of thought. Some people are like pre-treating before the BBL, like 4 to 6 weeks before they're done ovulating and then doing the procedure. Kind of depends on the patient too,
Yeah.
what they can do. And then others are doing it at time of procedure.
A lot of our patients, they come here, I'm booked out about 4 months, but every day.
Yeah,
That'd be a year if I just did 2 days a week.
yeah.
So a lot of patients I'm seeing like for the first time 4 weeks before.
Yeah,
So I may have to do everything at once.
yeah,
A lot of patients don't want to, they kind of want a general anesthetic.
yeah,
They don't want to like be injected 4 weeks before. And
yeah.
they want the convenience because they're already paying for it.
Yeah,
Convenience
and
of
they're
it.
asleep, which is great. It actually remarkably, like in.
2 minutes, Doc. Flank, left.
Ready?
Go ahead.
It's been interesting, just like, if someone's good at the logo, it's really pretty painless, believe it or not.
Ugh.
I know. Me personally, I'm like, not my ass.
This lady's from Edinburgh, Joe John. Is that Edinburgh, Scotland?
No, Edinburgh, Texas.
Oh, shit. They're from the south there.
You're asking now if we take
Do you
insurance?
get insurance? No.
No. We only do cash and like financing.
Well,
options.
financing, we have 10 banks we use. We can actually we financed the lady yesterday who said she didn't have anything. We found her money. Actually, the last case of the day.
So you're doing consults this Saturday?
I do one Saturday a month where I
Okay.
schlep in and
Yeah.
do my consults, and we start talking about it like yesterday. And we do videos every day about it.
Okay.
And 2 TikTokers are going to start Saturday. Will be with me.
So cool.
Yeah, I only do one time a month for the second spot at Stone Oak. Yeah, but Dr. Evans should know about this.
Yeah, absolutely.
Same thing tumescent, the same as we do for Sophina, right? Use a tumescent. You
Yeah.
can't just inject. You have to kind of tumescent the bud because you're coming down a lane.
Yeah. So when they're asleep, and not a whole lot of tumescent, just really for the epi when they're asleep.
No, I'm talking about when they're awake.
Oh yeah, when they're awake, yeah.
But
Yeah,
you have to
on-
tumescent the
on
line.
average- Huh?
You have to tumescent the line you're going down.
Yeah, you actually, we kind of teach to go in a ice cream cone pattern because like you don't, hypothetically you don't always know where you're gonna go.
Yes.
So we just
I was going to say you have to do full buttocks tumescent.
But it ends up being, we have like this limit lidocaine technique that we'll talk about using, and again, we can only speak to what was in the clinical trials. But on average, we use only about 95 to 100 cc's per like each butt, and then like each quadrant. So it's not a lot because we don't want to puff it up too much because we like, you can actually, we're recreating the depressions on the skin when we're cooking because we're only taking what's contributing to the depression.
Right.
So if there's too much tumescent in there, it just makes it a little bit harder to see the depression. You can still feel it tactily, but
All right, we'll look at it when they're asleep. And we'll do it when they're asleep the first time.
yeah. We're still learning the best ways to, when the patients are awake, but the majority of what I see now is in awake patients, which is interesting. I didn't expect that.
Was what?
I didn't expect that.
Which
I
part?
thought most of it would be done in the OR, but we have a lot of awake, which is also great for, you can probably do that with Sophina too, but patients you've treated in the past that you've done BBLs on that you didn't have this to offer them, they can always come in and get it done. Good way to bring in past patients.
How much is vaser upper back stuff? Is that a minute?
Yeah, a minute and a half.
It's a look. Don.
400, Doc, left flank.
What is?
Okay, you want to call the troops? I think they're all.
Over. Troops. All the troops.
Tell troops. $100, Doc, upper back. All right, you and I can head off. Thank you guys for watching. We'll be right back, everybody, when we turn over.